Hello, and thank you for watching this video about endometriosis and my story. I have had endometriosis now probably since I was a teenager but didn't know it. I was diagnosed in 2008. I had some large cysts on my ovaries removed, and at that time I was told I had endometriosis, which was quite a shock considering that my husband and I had been trying to have a child, and hearing that news made me certainly think that that was impossible, which I now know is not the case. And if you are hearing that you have endometriosis, I want you to have hope, to find out all you can about if you're interested in conceiving, about your possibility of doing so, because I did not think it was going to be possible, and I'm proud to say that I have a 17-month-old son now as a result of in vitro fertilization, and it was possible for me, and I hope it's possible for many others. My story is rather extraordinary. I'm writing a book as we speak, and it will be certainly explained in detail, but I can give you a little rundown of the story and some of my ideas. If you want to know what endometriosis is, I would suggest you go to a place like WebMD, Mayo Clinic website. Wikipedia has wonderful information on it, anything, because, not being a medical professional myself, I don't feel qualified to tell people what it is. I just know that every time I had my period, I had a very bad period, very hard, heavy bleeding, very hard to deal with. I had flu-like symptoms. I'd have vomiting and chills, fever, diarrhea, the whole nine. And once, and I didn't realize this wasn't normal, especially when I was young. I did not know that everyone didn't go through these things. I would go home. They would send me home from work. I would be pale. I couldn't even stand up for the rest of the day. I'd be in bed for a couple days. I didn't realize. I thought it was just the curse of being a woman. And years ago, people didn't talk about things in detail like they do now. And I'm very glad that I have this opportunity to tell people, if you are having problems, check it out with your doctor. When I was diagnosed in 2008, it's my understanding that endometriosis was only diagnosed through surgery. It was not diagnosed through any other tests. So while they're doing another surgery, they see you have it, and then they're able to tell you that that's what's happening. I knew something was very wrong for years. I just didn't know what to call it. Went through a lot of emotions, which I want people to know that when you have any disease, any kind of, news of any sort that throws you off, you want to know what's normal. What should I be feeling? I want to tell you that any feeling you're feeling is normal. If you find out you have endometriosis, you could feel very angry. You certainly could be depressed. You could feel hopeless. You want to blame someone. Who did this? Why do I have this? Who can I blame? From what I've read about it, it's environmental or hereditary. No one really knows. It could be a combination of both. Your particular situation could be different than someone else's. I've talked to people who say they got endometriosis from using birth control IUD or something like that. And I talked to other people who, like me, seem like they've always had the problem, and yet as they got older, things got worse. And I could say that, there are a lot of improvements being made with the testing, and I've been hearing about some wonderful things that actually might be happening to make it possible to diagnose this without surgery, which would be wonderful for many women who, might be able to do a simple blood test or urine test at some point in the future. I don't know that any hospitals are doing that now, but I did read something about that. So, there are things that are going to happen, and so that's hopeful. I want to get back to talking about how you would be feeling if you have it. Now, if you're in constant pain all the time, you can't get to work properly, you're not able to do things with your family, not able to care for children if you have them, not able to attend class if you're in school. They're all different things you are going to have a hard time doing. You're not going to be able to enjoy these things or get as much out of these experiences if you do attend, because you're in so much pain. I myself happened to be involved in college at the time, and I had a hard time getting to class sometimes. Other times I didn't make it at all, but I was very honest with my teachers. I gave them more information than most of them probably wanted to know about my health, because I felt that this way they know I'm not making this up. They know I didn't go out drinking and hungover. They knew that it was actually, medical reason. I actually went through my first surgery, having my cyst removed while I was in school, as well as my second surgery, which was actually having my fallopian tubes removed. Now you probably wonder, why would she have had that done? Well, it's a very interesting and very long story, but to make the long story short, I was going through in vitro. I was all set to have my eggs planted in my uterus. I was at the hospital in the operating room. My husband's by my side. We're waiting. They wanted to implant 3 eggs because of my age. And all of a sudden, all of the medical professionals ran over to the television screen where they had my where they had me hooked up in the operating room. They ran right over to the screen and they started looking and they started running around, and I thought, oh my gosh, what is going on? Am I dying? What is happening? And it was determined that I had fluid in my uterus. Now, because I had fluid in my uterus, they couldn't put the eggs into the fluid, obviously, because they told me that would be like throwing acid on these eggs. Well, that's obviously something we can't do. So they told me I had to have my tubes removed. So we planned the surgery, had the surgery, I healed, got back to the hospital, and was going to have my 1 egg, which is, they could only save 1 egg. So I had my 1 egg implanted in my uterus. And I was told if this doesn't work, even though they took my tubes, they can actually still get more eggs out of me. I could never get pregnant on my own without my tubes, but I couldn't get pregnant on my own anyway, and that's why I'd come to them. So basically it was a non-issue. So anyway, they told me there was about 20 to 25% chance this egg would work, and I thought, well, let's try it because you never know. And I can tell you from experience that the egg extraction is grueling. You have to be on hormones, you're taking shots, you're a slave to the time you have to take your shots. You have to be home, you have to be in the right spots. It was just a lot to go through, and my husband had to give me these shots. He was wonderful through the whole thing, and although I know we both would have done it again, we're very glad we didn't have to. That 1 egg did work. They had told me there was a very low chance, a 20 to 25%, like I mentioned, and it worked. I have a 17-month-old child, and this is 2011 when I'm making this video. And I could not be happier. So in telling my story, I want those who have the disease, who know people that have the disease, to have hope. You read a lot of the horror stories about the women who can never have children, whose husbands leave them, who are miserable. And I know those stories are true and they're real. And I read them and I felt their pain along with them. And I just wanted to share something very positive with those who are interested in the disease, and I hope that this has been useful information. I'm going to do a few more videos. I'd like to talk more about the feelings that you have when you have this disease. I feel like you can get the medical information anywhere, but the feelings, they don't necessarily tell you how you're going to feel, and it's important to know, and it's a very big part of the patient, you know, of the person who's suffering. So I will be doing some more videos. Please watch for them, and thank you.